Famotidine is an histamine H-2 receptor antagonist drug used to treat stomach ulcers, heartburn, gastro-esophageal reflux disease, and conditions where there is too much acid in the stomach, like Zollinger-Ellison syndrome, and multiple endocrine neoplasia. Talking about the mechanism of action of famotidine. This drug acts by blocking the action of histamine on parietal cells, which reduces acid secretion into the stomach. Famotidine is most often administered orally, either as a tablet or suspension, but it can also be administered intravenously. Common side effects of famotidine include headache, dizziness, constipation, and diarrhea. More alarming side effects can include confusion, hallucinations, agitation, lack of energy, seizures, fast or pounding heartbeats, muscle pain, and dark-colored urine. Prolonged acid suppression can decrease vitamin B12 absorption. Half-life of famotidine may be increased in patients with renal dysfunction, and dosage adjustments are needed in such patients. Famotidine can also cause QT prolongation in patients with renal dysfunction. So, that's all about pharmacology of famotidine. Hope you like this video. Keep sharing and keep supporting for more pharmacology pearls about different drugs. Thank you.